Hello, welcome to Balanced Health. I'm Shirley Rose, and this is Joe Costello, our resident health activist. Today, we're tackling joint replacements. From today's current count until the year 2030, hip replacement surgeries will increase 174%. Wow. And listen to this, knee replacement surgeries will increase a drastic 673%.
Hello.
This is mainly due to the fact that baby boomers are staying active for as long as possible. Well, joining us later on the show is Dr. Vineet Shah, an orthopedic surgeon from Dreyer, who is fellowship trained in hip and knee reconstruction, to update us on the advancements in joint replacement and the necessary precautions associated with surgery. But first, Joe is here as usual with some nutrition in the news, and you're going to want to hear this because it's very interesting.
As always we do, Shirley. Today's dose of nutrition in the news deals with vitamin K. If I were to tell you new research suggests that most adults are seriously deficient in a single vitamin, chances are you'd immediately think of one of the big name nutrients, vitamin D, vitamin C, folic acid. All good guesses considering the U.S. RDAs of these nutrients are dismally low, but the nutrient I'm referring to is one most people barely even exists, Shirley, and that's vitamin K.
You know, I think I've heard about it, but I couldn't tell you what it does, or, you know, it's just an unknown vitamin, isn't it?
It really has a myriad of health benefits. One of the things that people really don't know it for, one of its predominant properties, is for bone density. And that has to do with the way that it acts in the blood. It also is a wonderful blood thinner. And acts as a proper blood clotter. So,
so it would help with heart attacks, strokes.
It would. I mean, that's what I take on a daily basis. That's my version, if you will, of an aspirin a day. Instead of taking an aspirin a day, I take one thing people want to remember about vitamin K is that, well, let's back up for a second and talk about the foods that we get in it. Yeah. Vitamin K is found primarily in dark leafy green vegetables. So no wonder why so much of America is deficient in vitamin K. The amount of illnesses that people are seeing in, the doctors are seeing in people, and the consistency of vitamin K deficiency in these people, while it might not specifically state that vitamin K deficiency is a cause of many illness, it certainly is a common denominator. So common sense says if you see that in a common denominator of so many ailments, eliminate that, that possible scenario from your life, and it's easy to do so. So
How much vitamin K should we get each day?
Well, between 50 and 100 milligrams. It's a micronutrient. It's not something you would take in large amounts. And the one thing you want to remember, especially if you're going to be taking it in supplement form, is if you are on any type of blood thinner, if you're on warfarin, if you're on Coumadin, if you're on any type of platelet drug whatsoever, you definitely want to consult your physician before taking vitamin K. And in having said that, and I'm got a little smile on my face because I always kind of amazed at how often physicians will say that vitamins do nothing but give you expensive urine and are not effective or therapeutic in the system, in the body, and yet, the warnings are very serious about something like vitamin K. Do not take if you're already taking a blood thinner. Well, what does that tell you about what vitamin K does?
So they know. So that's admitting that the vitamins really do something.
And then it's extremely effective as a blood thinner. So if you're already taking a blood thinner, don't take vitamin K on top of it because you'll probably pass out.
That is amazing.
So,
well, now you said it comes naturally in dark green leafy vegetables like the spinach. Or broccoli, asparagus.
Spinach, broccoli, asparagus, green beans, anything, even your different type of lettuces that are dark, and leafy.
And how much of this would be in the Total Living drink? Because I know it actually has greens in it. Do you also add some K in the Total Living drink?
We do. On our Total Living drink, we add nutrients for the amounts that we want to make sure everybody has every day. It doesn't include all the nutrients that are in the greens. We know that there's more nutrients in those greens, much more in those greens, but this is to ensure that you're getting everything that you have in one drink instead of having to take
a bunch of different pills. So you do put a little small amount in there?
Yes, there's small amounts. It's all calculated such that nobody could overdo it on anything.
Well, that's good to know. Well, that's very interesting. And it's so great when you hear news that has vitamins in the news, because that used to never happen.
You've seen it more often.
That's right. Well, for more information on today's nutrition in the news, check out www.tln.com and then click on shows and then go to Balanced Health. Or to get a copy of today's show, call 888-242-9393. And after the break, the positive spin to sitting in the sun. I love this. Stay tuned.